Premier, thanks for joining us. Schools is a big question on a lot of people's lips. Will school be going back to normal in 10 days' time?
Look, I don't think Term 2 is going to look like a normal beginning of Term 2. It's going to be different. There'll be an arrangement where some students will be learning from home, and that's why it was so important to bring the school holidays forward so we could do that work around online learning. And it seems a simple thing, but it's a very complex task, and the Deputy Premier and Education Minister have done a great job. All their team have been working very hard. I know it's frustrating. I've got a Year 12 our eldest is in Year 12 this year. I know that people want answers and they want certainty. We'll give them that as quickly as we can. We're just putting the final touches on what school will look like. We're just at the midpoint of school holidays, so we do have a little bit of time, but we'll have more to say in the next couple of days.
On Year 12, we've spoken to a fair few Year 12 students this week. There's quite a bit of anxiety about what it means for their exams and their ATAR score if they want to go on to university next year. Can you provide them with any certainty if they'll be able to achieve an ATAR this year?
It is my aim that they can get an ATAR, if not within this calendar year, then very soon thereafter. We've got 6 or 8 weeks at the end of the year that we can catch up, if you like, when school was scheduled to finish. And when we get to that sort of Christmas holiday, we're in conversations with universities, with TAFE, we're talking to other states and territories and of course the Commonwealth. I know it's very frustrating, including in my own household. I can't give Noah, who's in Year 12, all the answers he wants, but as soon as we can, we will. The key point here is to get this right, and then when we make some announcements and answer some of these questions, those answers hold and are actually worth something. And the last thing we want to do is to be confusing our young people, all our students, but particularly those in Year 12. Our aim is to get an ATAR, get Year 12 done, whether it be this calendar year or just maybe spilling into the early part of next year. But it's stressful, I know. We'll give certainty and answers and some comfort to those young Victorians as soon as we possibly can.
With schools, are you determined to leave some schools open in some capacity so ensure people who are children of essential workers can keep going to school?
I think the whole notion of who is an essential worker has changed a lot. We probably didn't necessarily have enough respect for those people who are stacking shelves and working on the checkout at the local supermarket. They are critical, all the way through to the kids of nurses and doctors and others. There'll also be groups of kids, Rich, that are not able, for a whole range of reasons. They may not have the kind of IT that they need to be able to learn from home. We've done a lot of work in that space to give to households that perhaps don't have the best information, don't have the best tech, if you like. We're trying to give them access to the internet when they perhaps didn't have it. We can also do things the old-fashioned way. Homework can be sent out, kids can actually write on paper and then post that back. We're looking at all the different elements of this. We'll have some more definitive announcements to make quite soon, but I want school to be as close to normal as possible, but we just have to acknowledge that staying at home is the most important thing, and for many kids, learning from home will be the preference of their parents. We need to respect that and properly support it. That's the approach that I've always taken.
There's been some anxiety amongst healthcare workers and other hospital staff and GPs. There's simply not enough PPE out there to help protect them and stop the spread of this virus. You said you're ordering more. When will that actually be hitting the front line?
Some of it has already arrived. Gloves, masks, gowns, all sorts of different personal protective equipment. I understand the anxiety. They are heroes, those people, the work they're doing, the whole team in hospitals, not just those who are providing clinical care, but cooks and cleaners and ward clerks and orderlies. They're all doing an amazing job, and I thank them deeply. The fact of the matter, and I think that they know this better than most, everyone around the world wants the same thing at the same time, and that means it's very difficult. Some of our normal supply chain, some of the normal places we would get this sort of equipment from, they simply don't have any. Others have placed orders, but we do have quite a lot coming to us. We're confident that it will get here. Some has arrived already, and we're not cutting any corners. We're taking all these infection control protocols very seriously, because lives are at risk if we don't.
Were we prepared for this? Was the system ready?
Look, we have a national medical stockpile. We have, I think, the best health system in the country, principally because we have the best people in the country. At the same time, though, if you'd said 2 weeks ago that some of the things we've had to do, some of the steps we've had to take, if you had tried to convince people that that would be necessary, I think people would have laughed. This is unprecedented, and that's a word that's being used a lot these days, but truly, none of us have ever faced this in our lifetimes. This is genuinely unique. So yes, there was a lot of prep, a lot of planning, but some things you You'll always be tested, you'll always be challenged. And just at the same time, Rich, there'll be learnings once this is over. Once we get to the other side of it, then we'll look to see if there's things we can do better. That culture of continuous improvement. No one does that better than Victoria, because of course we are veterans of those 2009 fires, the worst natural disaster in our country's history, and the 10 years that have followed. We have built a culture where we always look to do better, do more, do better, learn from every single one of these challenges. We thought fires were bad enough earlier in the year. That seems a long time ago. But we've got to make sure we don't forget those communities. We've got to make sure that we send the right messages and that we do all the work necessary. Stay at home, protect the health system, save lives. That's the key message. People will grow bored of hearing me say it, but that's how we will prevent the kind of New York and European scenes, terrible, terrible tragedy, unbearable tragedy, where doctors are literally having to choose which patient lives and which patient dies. We just don't want that to happen here.
We've seen about 50 cases in the last 2 days, new cases. You talked about flattening the curve. Are we now at a point where the predicted peak is no longer May, June, it's come forward, or are we pushing it further out because of these numbers?
Probably a little bit too early to tell. We've had a few days of relatively stable numbers. That's good. It's much better than the alternative, where this thing is running away from us. There were very few days of stable numbers in so many of these cities in Europe and North America, where now they've got ice rinks being used as makeshift morgues. They've got a health system that has just been overwhelmed. I don't want that here. None of us do. And that's why I'm deeply grateful for every Victorian doing the right thing. Everyone who's making sacrifices, who's adjusting to a new normal. It's painful, it's very inconvenient, it's difficult. I absolutely get that. But that's why it's so important, and that's why I'm so grateful for the good work that people are doing. Too early, though, for us to be predicting when this is over. I wish I could tell every Victorian, here is the end date, and we can all work towards that. Frustratingly, that's not the way these things roll.
Is there a danger if you ease restrictions now or sooner, you might have a second wave, if you like?
There is. I think there is a real risk, and that's why we've got to follow the best advice, be grounded in evidence, not just here but in other parts of the world. This has come to us later than it came to some other parts of the world, so we can look at what others have done. Some well, some not so well. It's too early for us to tell, but I think the point you make is a good one. If you were simply to abandon all the restrictions we've put in place now, the very restrictions that are delivering us some stable numbers, then of course you would see cases go up, and you could potentially have a situation where, almost as a second wave, our hospitals were overwhelmed then. Ultimately, the key point here, we've got to protect the health system. That's the only way you can save lives, and the best thing each individual can do, stay at home.
Is your decision making based on worst case scenario modelling, and if so, what is that modelling today?
Well, there's going to be a conversation at National Cabinet this week, and there'll be some modelling that basically paints a picture across the whole country. There'll be some state-by-state breakdowns. Of course, all the modelling we do is worst case scenario, plan for the worst. That's the only appropriate way to go, and then take steps, ask a lot of the community, and then enforce those measures so that you don't get to that worst case. And so far, that's exactly what's happening, because people are doing the right thing, and I say thank you to all of them.
And what is that worst case in Victoria?
Oh, well, there's been, rather than me putting numbers out there, National Cabinet will look at these things, and there'll be some more modelling, more information will be in the public domain quite soon. What I can say, though, is modelling, a lot of modelling gets done. It's all based on the sort of assumptions. There can be debate and discussion about that. There'll be more modelling in the public domain quite soon. But what I can say is this: no health system will cope. Whether it be a big city hospital or a small regional one, no health system will cope if this thing gets away from us. And that's why it's so important that people do the right thing. And it's why I'm so pleased and grateful and proud that the vast majority of Victorians are.
You've set up a crisis council of cabinet in order to get other things on cabinet continue its normal work. Is your agenda, particularly construction in your major projects, are they still on track?
Well, a couple of points. It's probably too early to tell what the impacts of this coronavirus will be on a whole range of different projects, both government projects, level crossings, road and rail, hospitals, schools, and also private sector projects. The second point I'd make, though, is when we get to the other side of this, the biggest construction boom in our state's history will need to be even bigger. We will need to do more to protect jobs, to create new jobs, and to make sure that we bounce back from this as strong as we possibly can.
Is that one of the reasons construction is still going on right now?
No, I think the key point here is there's a number of points. you can still be in the construction sector and observe some of the social distancing practices. It's safe. That's the medical advice. Beyond that, some of the shutdown. If you were to shut down some of these jobs, public and private, it's not just flicking a switch. You've got to decommission equipment. You've got to do all sorts of things. So it becomes often very difficult to restart those jobs. But ultimately, safety is what's driving it. You can operate construction sites, albeit they're all different, but you can have that sector function and observe social distancing, increased hygiene. That's the medical advice. If the advice changed, then the status of that sector would change.
You've mentioned level 4 is still definitely on the cards. We may end up there.
I think that it is more likely that we have further shutdowns, that we go to a stage 4, but exactly when that happens, that isn't for now, that isn't for today. If and when that happens, then I'll be only too happy to talk to you and take you through chapter and verse what that means. The key point here is these numbers can change. We've had a few days that have shown us some encouraging, promising signs that the sacrifices every Victorian's making, they are working. That's a good thing, much better than the alternative where the thing gets away from you and our hospital system is overrun. But things can change. These restrictions seem like they've been in place for a year. They've been in place for a couple of weeks. I'm asking a lot of Victorians. I'm deeply grateful and very proud that they're working with me, my team, and indeed every Victorian's working together to stay at home, to preserve the health system and to save lives. It's simple, but it's so powerful. I'm very grateful to every Victorian. 142
fines in the last 24 hours. Do we need tougher penalties?
Not at this stage, but I wouldn't rule that out. It is a small minority, but it only takes a small number of people to do the wrong thing, and all of a sudden the virus is spreading, and it can be, by the time you find that out, by the time you work that out, it can be too late. So I don't rule out tougher penalties in the future. Again, it's a delicate balance, Rich. I don't want to be, thundering on at people all the time, but I do want to make the point. I'm very grateful, very, very grateful and very proud of so many Victorians, 90+%, who are doing the right thing. There are some who aren't. You shouldn't do it for all the reasons of being a decent person, but you also shouldn't do it because every chance you're going to get caught. And the fines, whilst they may go up, they're pretty significant right now. $1,600 on the spot for a person and up to $10,000 for a business. Just
back on the construction question, and you said
sure.
We need that to help the recovery.
Yep, we will.
Do we need to rethink a whole lot of other programs and spending? Is that going to be one of the next big challenge?
Look, I think the budget was put off in each state and at a Commonwealth level for very good reason. It's really difficult to try and make forecasts for what the next financial year looks like. But the budget being put off also presents us with an important opportunity to have a look at exactly where is the greatest need. And there will be a massive rebuilding project, a big project to stand with workers and their families, to look after the most disadvantaged, to repair that damage as much as we can. And I think things like, we've already got the biggest construction agenda our state's ever seen. Will it need to be bigger? Absolutely. And we won't hesitate to do that.
Just one final one. How are you coping?
Oh, look, this is very, very challenging. Early starts, late finishes. But look, it isn't about the politicians. I think people out there that are stacking shelves from all hours of the day, people that are making huge sacrifices, and of course those who've lost their jobs, my thoughts are with them. And I'm working for them. I'm working for those who, without the right policy, will find themselves queuing for a bed. They won't be able to get the care they need, and they will die. That's what is at stake here. But it isn't about us. We're just getting on with things. A lot of people are doing it really tough, and it hurts. It's painful. But I know we've got the right policy settings, and I know that we will get through this together. But it won't be easy. And the notion that we can just turn all this off in a few weeks' time, that's wrong. And we shouldn't be giving anyone false hope. We should be being honest with people. I think there will be a stage 4 at some point. This will be with us for weeks and months. That's just the nature of these things.
Premier Andrews, thank you.
Thank you.